Now look at the impact that the Delta variant is having in the United States. The variant, first found in India, is spreading in different parts of the world and is well on its way to becoming the dominant strain in the U.S., with cases doubling every 2 weeks. This according to the Centers for Disease Control and Prevention. As of June 19, the variant was responsible for 20% of new cases. Well, to talk more about this, we're now joined by Dr. Bob Watcher, Chair, Department of Medicine, University of California, San Francisco. Thank you so much, Doctor, for joining us. If you could tell us how big a worry is the Delta variant in the U.S. currently?
There are definitely concerns. If it weren't for the Delta variant, the United States would be doing very well. It is doing quite well. The case rates are very low. The death rates have come down tremendously. There's still about 300 a day in the United States, but that's down from several thousand. But the Delta variant is spreading very quickly. We're really mirroring what happened in the UK just a month later. So we've gone from a few percent last month up to 20% Delta variant, and the predictions are will be majority Delta in a month. The good news for the United States is the population is fairly highly vaccinated, but there are tremendous disparities, mostly by region. So there are parts of the country, like where I live in San Francisco, where 70 or 80% of the adults are vaccinated. There are parts of the country where it's 20%. And so we are predicting, because Delta is more infectious and might be more serious, that there will be surges in the next few months, mostly localized in areas that have lower vaccination rates.
In fact, I wanted to ask you about that. You know, with the sizable proportion of the population vaccinated, there's also a regional difference. So what has the experience been? What are you seeing in the more vaccinated and the lesser vaccinated areas?
Yes, and I hope that India is able to catch up as quickly as possible. What we're seeing is in highly vaccinated places, California is one of them, the number of cases is very low. When there is someone who gets sick and goes to the hospital, in the vast majority of cases, it is someone who is unvaccinated. In parts of the country where vaccine rates are lower, the case rates tend to be higher. They're still not that high. I think the entire country is benefiting from the fact that overall there's a lot of vaccinated people around. But we're a little bit worried the virus is probably seasonal, meaning there probably will be surges come the fall. And I think we may be getting lulled into a false sense of security now. The case rates are fairly low everywhere, in part because the majority virus is still not Delta, but within a month it will be. And so that is the concern, that the parts of the country that have low vaccine rates will start seeing more cases because of Delta. Whether they're going to see more breakthrough cases, I think the data would say probably not. It looks like the vaccines that are mostly being used here, which is Pfizer and Moderna, are holding up very, very well against Delta. And so, most people in places like California, the majority of people are fully vaccinated. It looks like that will hold up against Delta very well. So we will see some breakthrough cases, but relatively small number. And the people with those vaccines, the rate of them getting very sick, going to the hospital, and dying is very, very, very small. So this really is going to turn into a tale of two different countries, really. Parts of the country that are highly vaccinated that probably will do fine, parts of the country that have low vaccine rates, where particularly those people who are unvaccinated in the parts of the country with low vaccine rates, I think are quite vulnerable as Delta becomes the majority of our virus.
Right. We are seeing reports that the southern states, you're seeing a high vaccine hesitancy. But anything new that we're seeing this year, any new symptoms being reported in this round of infections?
Well, we are seeing that the Delta variant seems to lead to some different symptoms than the original and the Alpha variant. Less cough, less loss of sense of smell, more people with headaches, more people with gastrointestinal symptoms. So it does appear that the variant is leading to somewhat different symptoms. In terms of long COVID, we've known that all along, that some people have persistent symptoms. But there are now better studies coming out telling us how frequent that is, and it's fairly frequent. A recent study said 30% of people with COVID will continue to have symptoms more than a month out. We used to think that was about 10%. So, and the symptoms are quite varied. And so, yes, the virus just continuously surprises us. Always new things coming that we learn about as time goes on.
In fact, we're still learning about the Delta variant, and here in India we have what we're calling as the Delta Plus variant. In fact, some cases being reported in the United States as well.
That's what I tell people who haven't been vaccinated, that your body has not gotten any smarter in the past 18 months. Your body is no better at fighting the infection, but the virus has gotten much smarter, much more clever, much better at its job. Whether this Delta Plus is clinically meaningful, I think it is up in the air. We haven't seen data that shows that it is, but certainly, I spent much of 2020 telling people, yes, there are lots of mutations, there are lots of variants, but there's no difference in any of the important factors, how infectious it is, how serious it is. But that really changed with the UK, the Alpha variant. And now since then, we've seen the Beta, the Gamma, the Delta. And I think given the amount of new spread in the world, there's no reason to believe there won't be other variants that have different properties. And so it is another reason why we think it's incredibly important to make sure everybody gets vaccinated as quickly as possible. I think most people in the U.S. who are paying attention realize that we're in a very nice position and that the majority of people in the U.S. now are vaccinated. But it's almost become a cliche, but the idea that no one is safe until everyone is safe is very real.
Right, absolutely. Dr. Bob, thank you so much for joining us here on the show.